The first of the 6 quantities that we need to gather is the number of strata in which the survey will be conducted in the country. This will usually be suggested by the survey steering committee, and it has to do with where do they want to have representative results. If we use the example of Burkina Faso, of course, is one country. It has 13 administrative regions, and it has 63 health districts. If the steering committee only wants to know coverage at the national level, then there's one stratum in the survey, and the value for quantity A is 1. If they want to have results that are representative at the regional level, well then that's 13 strata. We'll be doing 13 simultaneous surveys, or maybe 13 surveys one after the other if you used one team and they went from region to region to region. But the survey will essentially be repeated in each region. It'll be done 13 times. And if they want district level results, then there are 63 health districts, and the survey would need to be conducted 63 times, and the value for quantity A would be 63. Now, if you do regional surveys or district level surveys, you can also, as I mentioned earlier, aggregate results across those subnational strata, and you can calculate a national coverage figure. When we're thinking of results, we might think of the national level as another stratum, and it is a stratum, it's a row in the table. But when we're doing sample size calculations, we don't count the aggregated levels. So if you do 13 regional surveys, then the number of strata is 13. And even though you're going to calculate national coverage, we don't have to increase A to be 14. We leave it at 13. And if you're doing 63 district level surveys, then A is 63. And we don't have to count the additional 13 regional results we'll get or the additional national result that we'll get. Of course, you might be wondering, what if the steering committee asks me how many strata they should use? They may put you on the spot. And as we just said, there's a sense in which we're doing a separate survey in each stratum. So the question comes down to this tension. You probably need to turn the question back around to them and ask them, do they need very granular results, like results in every district? And if so, can they provide the resources to do that many high-quality surveys? If the results are going to be used to make decisions and manage the program, then you should only conduct the survey in as many strata as you can afford to do and still guarantee high-quality field work. So there will be some tension between what they want, perhaps, and what they can afford. This is a value you can change in later rounds. When you come back to repeat the sample size calculation, you could decrease the number of strata and see what that does. Our guidance to you would be probably, when in doubt, you should do a survey with fewer strata to be sure that you can maintain high-quality field work with as little bias as possible. Here's a map of Burkina Faso showing the 13 regions. Of course, the regions are nested within the national boundaries. And then if we look at the next slide, we have the 63 health districts, and the health districts happen to be nested within the administrative regions. So again, if you do a district level survey, 63 different surveys, you can combine data across the districts within a region to calculate regional results. Those regional results will be quite precise because you're aggregating a lot of data together. And then if you aggregate even further data from 63 surveys to calculate a national level result, that sample size will likely be very large and the results will be very precise. So again, this first item, item A, is the number of strata in which you will conduct the survey.